Hi, everyone. My name is Jillian Parker. Thanks so much for joining us for today's Facebook Live discussion. Today, I'm joined by Dr. Daniel Day. He is an orthopedic and sports medicine specialist with Rochester Regional Health. And with school starting back up again, we thought it was a perfect time to talk about some concussions and active approaches to treatment, and one specific active approach to treatment that has been evolving over recent years. Dr. Day, thanks so much for joining us.
Happy to be here. Thank you.
I just want to remind everyone, if you're tuning in, feel free to leave any questions in the comments section, and we can circle back around at the end of this interview to get to some of those questions. But I'll just jump right in with you for now, Dr. Day. Let's talk about, like I said, we're going to talk about concussions and sports, student athletes in particular, ramping up their sports activities again. And we know that there are different protocols in place to help athletes who may have concussions. Are there different forms of treatment for a concussion? And does that depend on maybe what the severity of the concussion is?
Yeah, so like you said, concussion treatment and approaches have been evolving over the years. We've really moved more towards an active approach to treatment. So before, it used to be, don't do anything, get as much sleep as possible, dark room, no screens. And we're really taking everything away from the kids. So we take their social media away, we take their friends away, we take their sports away, we take their school away. That leads to stress, anxiety. We put them in a dark room, and before you know it, they're sleeping all day. They can't sleep at night. Now they almost become more of a victim of the treatment rather than the concussion itself. The good thing about concussions is most of them are self-resolving and limiting and resolve over the course of a few weeks and kind of go through that progression. But if we found that if we help them along and give them a good treatment strategy, then we can make sure that they get better as fast as their brain will allow them to recover.
Go ahead.
So, I mean, what that really looks like is getting them into good routines, reestablishing things that they'd normally be doing, but doing it in a safe and protective way that they can progress through.
I know we were talking about a specific form of treatment, you and I, that you said is kind of evolved. It's not new per se, but it's been evolving over the last few years, this concussion treatment. Can you talk about what that is and what it entails?
Yeah, so we found that we don't have to put them in a dark room. We can actually progress them as long as we're doing it in a good approach and a safe approach. So what that entails, usually what I'll say is the first thing is getting them back into a good sleep routine. So I actually want them going to bed at a normal time and then waking up at a normal time. So we're eliminating daytime napping, we're eliminating long sleep at nighttime, because eventually that internal clock starts to get flipped upside down. And when that happens, now you're not sleeping well, and it could just be a product of not feeling well because you're not getting good sleep. So first thing is a good sleep routine. The second thing is we want them exposed to things. So we want them doing their normal household stuff. We want them exposed to friends and family. Actually want them exposed to light and screens. Those are all things that's going to start to get them back into the pattern of their normal activities. The biggest catch is going to be they may only be able to do a little bit. So if they can only be on their phone for 5 minutes and then they need a 10-minute break, then that's what they can do. And then as long as they abide by that and they're controlling their symptoms with these short, frequent breaks, now we keep their symptoms more even keeled throughout the day so they're not getting way up, and allow them to sleep better at night. And they're happier because they're engaged in things they like to do. They're doing more things with just breaks. They're getting a good night's sleep. And before you know it, they're starting to feel better.
I know sleep, obviously, one of the bigger benefits from that specific form of treatment that you just mentioned. Any other specific benefits that you want to mention for that specific treatment?
Yeah, and I think if you look at even brain studies for the long term, it keeps coming back over and over that exercise is good for the brain. A good sleep pattern is good for the brain. So brain health in the long run, you'll find that people that have less risk of brain problems down when they get older they usually have those good routines. So it makes sense that when the brain's recovering, that we're optimizing their sleep routine. We're making sure that they're starting in on some early light exercise, again, to symptom control and taking breaks when they need to. And that just helps give that sense of normalcy, helps the brain, helps you feel better quicker, and then they can get back to their activities of daily living and sports even faster.
Can you talk about passive treatment and what the potential negative effects of that can be?
Yeah, so I mean, the passive treatment again is just putting them in a room, putting them in a dark room, taking everything away from them, giving them that true brain rest.
Hmm.
So that's really what most people will advocate for, and that's going to be fine for a day or two. I don't think there's any harm in that. You do feel pretty tired after you get hit and have a concussion, so if that's the initial response, I think that's fine. But we need to move away from that fairly quickly within that first few days to first week. Otherwise, you just fall into that rut, and it's hard to get
Hmm.
kids out of that rut. I'll see kids 4 6 weeks after their injury, and by the time they see me, they haven't been in school for 4 weeks, so they're super behind. And if they were struggling before, it's only going to make it worse. If they're more high level student and they missed that much, it's just creating stress and anxiety. Now they're sleeping all day. They're not getting a good night's sleep, so there's no way they're going to wake up for school. So they're just in this rut. And then we kind of go through and flip them upside down, get a good night's sleep, start to progress their exercise, get them
Yeah.
back, their bodies moving. And 2 weeks later, they're feeling great and they're back to school and like nothing happened. So it's almost like they were being a victim of the treatment rather than the actual head injury.
Right. And I feel like we've seen a lot more about concussions just in the news, in recent years. Can you talk about some of the misconceptions as it's related to concussions?
Yeah, I mean, there's a lot in the media, and there's certainly things to be nervous and scared about when you talk about concussions and head injuries. So there's no downplaying any of that. But I think what you find is it often the bad things get reported in the media, and that's really the few and far between.
Hmm.
So the ones with chronic brain changes and CTE, those are the ones that are getting tons of impacts, thousands of impacts over their lifetime over the years. Whether it's the sport they're playing or they're just playing at a higher level for a longer period of time. So those impacts add up over time. You get the kid that plays soccer or football or has a few concussions along the way. Those kids are probably going to be fine. They go on, they get their education, they go on to their careers and their jobs, and those are just a few impacts through their lifetime, rather than those thousands of impacts. Obviously, that can change as we get more research. There's a lot of research going on, but I think a lot of the more significant things that you see in the media probably are the fewer and far between.
I just want to welcome in any new viewers who are tuning in. We are talking to Dr. Dan Day today about concussions in particular, as it's connected to student athletes, especially with those student athletes beginning their sports activities again for the season. We were just talking about some of those misconceptions, common hits in sports. Can you talk a little bit about that and how it could be difficult to tell if a student is at risk of a concussion or not, and what is just a common hit that we would see?
Yeah. Yeah, I love this question because it really can be deceiving. When I did some of my training down at Virginia Tech, we actually had sensors in all of the helmets at football practice. So we had a whole system on the sideline. We could tell what kind of forces they were taking for each hit. We had a pager when somebody took a higher than 80 G hit, so we'd go and evaluate that person. But what we ended up finding was not always what happens on the field really meets the eye test. So you can really get somebody that has a big impact, and you're kind of rushing over to them and being like, that was a big hit. And they pop up and they're doing just fine. And then it registered as a 50, 60 G hit, and it really wasn't that bad. They were able to sustain that force. Then you get some that looks like they just get clipped on the field. and the registers as 100G hit. So just there's different forces that go through the brain. Some are linear, some are rotational, and it's very hard to see that with the naked eye. So you go back, you look at the video, you see what the sensors say. It's hard to take every hit to that. You have to take the whole thing into consideration. So yes, they had an impact. They're symptomatic. So that force was probably significant enough to cause that change, and they should be taken care of at that point.
Do you have any advice for parents, if they think that their kid, they're not sure maybe if their child is suffering from a concussion, especially for kids who, may be playing sports outside of school where they may not have the same kind of access to trainers and different trainers and nurses?
Yeah, and parents and coaches that know the kids, they're usually the best resource too.
Mm-hmm.
They're going to find that, my kid's not acting right. I know what my kid was like before this practice. I wasn't at the practice. They said something kind of happened. He's not been the same. She's not been the same since. So a lot of times you rely on those people close to them, whether it's family or coaches. And if they're concerned, then it's worth looking into as far as potential treatment. Sometimes that could lead to concussions being overdiagnosed. Could they just have a migraine? Could they have had a stressful day at school? Could there be some anxiety component of something that happened and they're just feeling a little bit under the weather sort of thing? Sure, that could happen. And if that's the case, usually you're getting a pretty good exam in the office. You still put them through the concussion protocol, which takes 5-6 days. And as long as they get through that, then even if it was overdiagnosed, you keep them safe and let them get back to play that way.
I know we've talked a lot about concussions as it's geared specifically towards student athletes, but that's not the only group of people who sees treatment for concussions or can have a concussion. We see other non-student athletes as well. So can you talk a little bit about, the fact that other people can see treatment with Rochester Regional Health for concussions, not just student athletes?
Yeah, I mean, impacts come from all over, right? You could fall off your bike, could happen in gym class, and then could happen with adults too. So, you got car accidents, you get all sorts of things where you could get a head injury. And, the nice thing in the sports world is you've got your coaches, you've usually got your family that's there close by or on the sideline. You sometimes will have a trainer there that can provide immediate evaluation. So the athletic kind of concussion is much more streamlined than, say, something that happens in gym class. Nobody really sees it. They've been off for a few days, and then you kind of start to figure out, oh, well, they took an impact in gym, and now we have an issue. Or even the car accidents, maybe you do get evaluated, but you're in the ER, scans are fine. But then you just get this residual symptom for a week or two, and then you start to say, maybe there's a little bit more to this. So you kind of treat things the same, but it's one of those that sometimes they don't get recognized right away. Within our system, we've got a whole team of different docs, from sports medicine docs to physical medicine and rehab docs to neuro docs. And we all kind of have our area of expertise within that and can guide patients through depending on what their scenario is.
Is there anything else that you want to add that I'm missing as it's related to either student athletes or something about the concussion clinic?
I think the other thing that we kind of do too, and we incorporate this into our active approach and is worth mentioning, is we have a great vestibular therapy department, and we utilize them a lot in our concussion rehab. So basically what vestibular therapy is, it's physical therapy for the eyes and the balance system. And those are the things that kind of get affected when you have a head injury. It's almost like the wires get crossed. So we're working on rewiring those systems so that symptoms can settle down and they can start to progress. So it becomes a series of eye and balance exercises that are hard at first, but the more that they keep doing them, the easier they become, the less symptoms they have, the sooner we're getting aerobic exercise back on board. So it really helps to have that component built into our approach. we can do the education at their first appointment. We get them set up with vestibular therapy, which gives us close follow-up with them. They're also really good at picking out when things are not quite right. So a lot of times we'll get feedback as a doc saying, hey, I've spent, a good hour and a half with these folks over a couple of visits, and something's just not right. It's not adding up the right way. And it allows us to troubleshoot and figure out, do we need to change something? Is there something else going on? So it adds a level of cushioning there so that we can make sure that the patient's going the right way. And I don't just see them back 2 weeks later and they're like, well, that didn't go well. And they're kind of worse off than when we started.
Yep. Dr. Day, thank you so much for taking some time to talk to us today about concussions, the concussion clinic, different active forms of treatment for concussion, especially as students are getting ready to go back to school. I know school sports for the most part have started again, but thank you so much for joining us.
Thank you.
And anyone else, if you're watching this after we are no longer live, you can still feel free to leave any questions you have in the comment section and we will get back to them later. Thank you. And everyone be safe and have a good day.
All right. Thank you.